Dr. Cowan, you are the Speaker of the Will County Board. Tell me just a little bit about what it's been like over the last year during the pandemic. What are some of the challenges and what are some of the accomplishments that the board's been able to achieve?
Sure, yeah. I've been the Speaker for 11 months now, and so my entire term as Speaker has been during a global pandemic. And that's been an interesting situation. In some ways, it's radically changed how we work. In other ways, we're business as normal, keeping the wheels on and keeping things moving. In terms of our work, what's been challenging has been making sure our community gets what they need.
Tell me a little bit about the CARES Act.
Will County received just over $120 million in CARES Act funds from the federal government. At first, it was very much directed towards sort of PPE expenses, businesses that had to maybe put up plexiglass. It was all happening very quickly. It was challenging to do quickly, but we knew we needed to get that money out the door as fast as possible. What we did was made different categories. We're going to allocate this much money for small businesses. We're going to allocate this much money for local governments and this much money for farmers and this much money for schools, those kind of things. We made those decisions, and then we were able to cut checks pretty quickly. So over $20 million went to local small businesses to help offset those COVID expenses.
So Congress recently passed more legislation. Tell me a little bit about what the American Rescue Plan provides for Will County.
The federal government passed the American Rescue Plan, and it's sort of CARES Act Fund Part 2. Will County is going to be receiving about $134 million. So we are certainly going to do some of the same things we did with the CARES Act money. We're going to have a small business program, especially focusing on restaurants and bars, hospitality industry, other businesses that have been really hit hard. But then we're going to really be looking at how we can invest this money in our community to make some long-term positive impacts.
Tell me a little bit about what the board has been doing to address housing needs and housing issues in the county.
When you're laid off or your hours are reduced, one of the first things you start to worry about is, how am I going to pay my rent or my mortgage? And that's been an unfortunate reality for a lot of people in this last year. And there's been, moratoriums on evictions, and that holds things off. But what happens then is you then have landlords and small business owners who can't pay their mortgages because they're not getting in the rent from their buildings. And that's really a potentially snowball problem that we don't want, right? Luckily, the federal government has come out with the Emergency Rental Assistance Program, and we've worked at the county to set that up in concert with the state and federal authorities. So if you are behind on your rent, you should go to willcountyillinois.org. There will be an application there.
Tell me a little bit about what the board has done to support the health department.
I think the Department of Public Health really does things that we don't think a lot about until they go wrong, right? So they're providing a critical service. And we knew early on they were going to need support. They were going to have to expand their staff. They were going to have to expand their program offerings, just from having to deal with, at first it was testing, and then it was contact tracing, and then it was into the vaccine distribution, right? So we made sure that they knew we were available for their requests. And last fall, we were able to give them a $3 million grant from the CARES Act fund. And that has funded a whole range of things: increase in staff, their contact tracing program, and specifically, we asked them to set up the call center. One of the other things that has been very important to the board is the idea of vaccine equity. So we provided the funding, and the health department has hired a vaccine equity manager. So this is someone who is well acquainted with the issues surrounding equity and healthcare, and specifically vaccines in our community. So she really focuses on, how do we make sure we're not leaving anyone behind?